Today we are going to start a new topic, bronchitis. Bronchitis is a disorder in which there is a permanent, irreversible, abnormal dilatation of bronchi and bronchioles. The dilatation of bronchiole and the bronchi is caused by the destruction of the muscles and the elastic tissue of bronchial walls. It is present as a secondary disorder at the end of the stage of many unrelated disorders. It may be divided into obstructive and non-obstructive. Now we will discuss about non-obstructive disorder. It is usually a diffused type of which is characterized by dilatation throughout the lung. Post-infection. It may result into the chronic necrotizing infection. That is maybe due to bacteria, Mycobacterium tuberculosis, staph, influenza and pseudomonas. Viruses, adenovirus, HIV, influenza viruses, fungi, aspergillus. Now comes the genetic cause. Catragrin syndrome, Young syndrome, and dyskinetic ciliary syndrome. It is an first comes the categoric syndrome. Autosomal recessive, lack of ciliary function, cause retention of secretion, recurrent infection. It comprises of sinusitis, bronchitis, tachycardia, and male infertility. Under Young syndrome, the patient develops bronchitis, sinuses, obstructive azoospermia. It is the cause is not known. And the disorder, the deficient cilia throughout the body. It includes the radial spoke deficiency and the absence of central doublet of cilia. Now comes the immunodeficiency. The patients with hypogammaglobulinemia, IV infection, bronchitis, and obterence after lung transplantation have increased susceptibility to infection, that is localized or diffused bronchitis. Localized and diffused type. Now comes the autoimmune disorders, that is rheumatoid arthritis, SLE, inflammatory bowel disease. Immune mediated diseases, that is allergic bronchi and pulmonary aspergillus. Bronchial obstruction. It is caused by the tumor, foreign bodies, aspiration and mucus plug. Cystic fibrosis. Many respiratory diseases in cystic fibrosis are sinusitis and bronchitis. Now comes the pathogenesis. Is a complex process. The both obstruction and chronic persistent infection are the two major etiological conditions which seems to be necessary for the development of bronchitis. Obstruction impairs the cleaning mechanism of the lung, results in accumulation of secretion distal to the obstruction. Secondary infection, inflammation, weakening and dilatation of walls. Now comes the chronic persistent necrotizing infection. Chronic infection in the bronchioles, increased bronchial secretions, obstruction of airways by excretion, inflammation of fibrosis of airway of lung wall, and weakening of dilatation of air walls. Bronchitis is associated with cystic fibrosis. The importance of both the infection of bronchitis, that is cystic fibrosis, the defect in the mucociliary action, and there is accumulation of thick viscous secretions which obstructs the airway and favors the microbial infection. Now comes the classification. It divided into shape of bronchial dilatation and extent of involvement. Saccular, cylindrical, fusiform and varicose. In under extension of involvement, generalized and localized. Here's the difference, you can relate it. Under gross morphology, let's see the gross morphology. Bronchial walls, these are dilated, traced at almost up to pleural surface. Extent of dilation, 4 times the smaller size. Surface, the wall of thickened by fibrosis. Lumen, thick. Mucoplurant, secretion, mucal surface is congested. Dilatation and the bronchioles due to severe inflammation. Dilatation of bronchi severity may lead to lung abscesses. Due to infiltration of chronic inflammatory cells may lead to formation of lymphocytes and plasma cells. Then the fibrosis of bronchial walls. It occurs in the chronic cases. It may result into partial or completion obstruction of the bronchial lumens. Mucus changes. Dequamation of the lining epithelium and the air of ulcerations are seen. Lining. Columnar cells shows the pseudostratified and squamous metaplasia in the surrounding epithelium. Here you can see the table of pathogenesis of bronchitis. Obstruction and chronic. Obstruction. Partial obstruction or total obstruction. It may lead to clearing of mechanism of lung, then accumulation and secretion, which ultimately will lead to bronchitis. वीकनिंग एंड डायलिटेशन होएगी, फिर उसके बाद ब्रोंकाइटिस होएगा. Chronic necrotizing infection में बैक्टीरिया, वायरस, फंजाई अटैक, increased bronchial secretion, obstruction, inflammation of fibrosis and airways. These are the different types of